Mouth cancer causes grow as cases skyrocket in UK. Cases of mouth cancer in the UK have increased by more than one-third in the last decade to hit a record high, according to a new report. The number of cases has more than doubled within the last generation, and previous common causes like smoking and drinking are being added to by other lifestyle factors. According to the Oral Health Foundation, 8,864 people in the UK were diagnosed with the disease last year, up 36% on a decade ago, with 3,034 people losing their life to it within the year. This is an increase in deaths of 40% in the last 10 years, and a 20% rise in the last 5. The findings are part of the Oral Health Foundation's new State of Mouth Cancer UK Report 202, which has been released to coincide with November's Mouth Cancer Action Month. In the early stages, mouth cancer symptoms can be subtle and painless. They could be a mouth ulcer that doesn't heal within 3 weeks, white or red patches in the mouth, unusual lumps or swellings in the mouth, head or neck, or any persistent hoarseness in the voice. 1 in 3 mouth cancers are found on the tongue and 23% are discovered on the tonsil. The other places to check for mouth cancer include the lips, gums, inside of the cheeks, as well as the floor and roof of the mouth. Nearly 2 in 3 people have never checked their mouth for signs of mouth cancer, despite it taking less than a minute. People are 3 times more likely to routinely check for testicular or breast cancer. Survival rates for mouth cancer have barely improved in the last 20 years, partly because so many cases are diagnosed too late. Just over half of all mouth cancers are diagnosed at stage 4, where the cancer is at its most advanced. Dr. Nigel Carter, the chief executive of the Oral Health Foundation, said, "While most cancers are on the decrease, cases of mouth cancer continue to rise at an alarming rate." Traditional causes like smoking and drinking alcohol to excess are quickly being caught up by emerging risk factors like the human papillomavirus, HPV. The stigma around mouth cancer has changed dramatically. It's now a cancer that really can affect anybody. We have seen firsthand the devastating effect mouth cancer can have on a person's life. It changes how somebody speaks, it makes eating and drinking more difficult, and often changes a person's physical appearance. During Mouth Cancer Action Month, we will be raising greater awareness of mouth cancer. We urge everybody to become more mouth aware by being able to recognize the early warning signs of mouth cancer and to be aware of the common causes. Most importantly, if you notice anything unusual, please don't delay and seek help from a doctor or dentist. Charlotte Webster Salter was given the life-changing news that she had mouth cancer when she was just 26. The ex-cabin crew member, who is now training to be a midwife, does not fit the typical mouth cancer patient, being an active young woman who does not smoke. But Ms. Webster Salter represents a growing number of younger people who are being diagnosed with the disease. Ms. Webster Salter added, "There is a stereotype for mouth cancer. I was told, oh, you're too young, God, it won't be that. But it really can happen to anyone, not just smokers."